Hypertension is the leading cause of death in the United States of America. No, it's not. Heart disease is the leading cause of death in the United States of America. This is accounting for around 800,000 deaths each and every year. And one of the biggest risk factors associated with this is hypertension. So what exactly is hypertension? Now, ideally, your blood pressure should be 120 over 80. The systolic is 120 and the diastolic is 80. The amount of pressure that's leaving while your heart's contracting over the amount of pressure when your heart is relaxing. Why is this important exactly? Is you can imagine as the pressure leaving the heart being water in a watering hose. The higher that pressure is, the harder the heart has to work, the worse downstream effects that can occur. Now, one of the biggest issues is that we don't see these issues immediately. We can see it 10, 20, 30 years in the future. Hence the reason hypertension is known as a silent killer. So what is considered high blood pressure? If 120 over 80 is considered normal, then hypertension is having a top number that is greater than that. Pre-hypertension is 120, 121 to 129, stage 1, 130, stage 2, 140. So why is this important? Not only can it cause these downstream effects in the future regarding the heart, it can cause a lot of different things. Strokes, heart attacks, heart failure, dementia, financial burden with the multiple hospitalizations and multiple medications. So we have to treat this now to prevent something drastic from happening in the future. So what exactly are the symptoms of hypertension? Hypertension is known as a silent killer because it really does not present with any symptoms. But if the blood pressure is high enough, you can see some people complain of headaches, sometimes dizziness, sometimes even nosebleeds. But for the majority, they don't have any symptoms. Are there different types of hypertensions? And the answer is yes. For the majority of people, they have primary hypertension, meaning that you just have high blood pressure. There's no rhyme or reason as to why. Now, for a lot of other people, there is secondary hypertension. This means that the hypertension is due to something else. The most common cause in the United States of America is obstructive sleep apnea that is untreated. Other causes include fibromuscular dysplasia, renal artery stenosis, aka blockage in the kidney arteries. Hyperthyroidism or hypothyroidism can cause this, and a host of other endocrine issues, things like pheochromocytoma or issues with the adrenal glands. So if you find that someone has hypertension and there's no real rhyme or reason cause, but more importantly, they have hypertension that is very difficult to control, we start thinking about secondary hypertension, looking for those other causes that could potentially be causing it. And I found that a lot of them is due to a combination of obesity and obstructive sleep apnea. If your sleep apnea is not treated, no matter what medication you throw at the individual, that blood pressure is going to remain resistant for a lot of people. So even though we know that there's primary and secondary hypertension due to something else, are there risk factors that are associated with hypertension? The answer is yes. The older you get, the higher the propensity of having hypertension. If you have a family history of hypertension, such as your mother, father, or siblings, you too may also have high blood pressure. Smoking is a huge risk factor. Alcohol is a huge risk factor. Adding too much salt, lack of exercise, or living a sedentary lifestyle. A lot of times we recommend for people to get their labs checked because low potassium can also cause hypertension. Stress is a huge factor, whether that's not getting enough sleep or the stresses in your life. Most importantly is other medical conditions can also lead to hypertension. Hence, it's extremely important to follow up with your primary medical provider to get this workup for hypertension and to potentially rule out other causes that can be contributing to your hypertension. Now, the most important question is why? Why is this important? And we've already mentioned heart attacks, strokes, dementia, kidney disease, end-stage renal disease that can lead to needing dialysis. What other things do we find with hypertension? Things like aneurysms, things like heart failure, issues with your eyes. It can even affect your sexual organs, leading to erectile dysfunction. So it's extremely important to not only know whether you have hypertension or not, but to also start treating it now, looking at the risk factors, treating those risk factors, following up with your primary medical provider on a routinely basis, and potentially seeing other specialists if there's downstream effects such as heart disease. Now, how do you treat it? This itself can be a whole list of a whole nother video, but to keep it simple, there are natural and medical ways that you can treat it. The natural ways is being fit, exercising, watching what you are eating, weight loss being a big contributor to it, because the higher your weight is from ideal weight, the elevated the chances are that you're going to have hypertension. So we start working on those things, those lifestyle changes to decrease the blood pressure. But we find that a lot of people, even despite that, still have hypertension. And that's when we start to utilize medications, things like calcium channel blockers, sometimes beta blockers, nitrates, ACE inhibitors, aldosterone receptor blockers. This is going to be a whole nother video, but medical therapy is warranted when lifestyle changes are not enough. If you found any benefit in this video, hit that like and subscribe button.